Everybody wants to know about my shoulder. Look at those muscles. Everybody wants to know about my back. And everybody also wants to know about my knee. I haven't made a video since last time because I actually ended up getting a second surgery last year. Things went pretty sideways for me, and it wasn't a typical situation, so I didn't want to discourage anybody by what happened to me, and I wanted to see how it went over time. I pushed it for 1.5 years, and now I'm making the decision to get a total knee replacement. We're actually going to the hospital today. I felt like it was a good time to start making videos again, touch base with you guys. I know it's been a while. You don't always have the motivation to make videos, especially when things aren't going your way. But people have been asking about the shoulder, my back, my eyes, all that stuff. All that stuff is fine. Once in a while I have a little bit of pain or it bothers me a little bit, but it's not really impacting my life at all. I still train Muay Thai as much as I can. I coach Muay Thai. I still have my job as an auto mechanic. All very physical stuff. My partial replacement for my kneecap last year, like I was starting to show in my videos before, my kneecap wasn't tracking very well. It was actually getting caught at the edge of the implant a lot of times and jumping back and forth. That never really went away. They did a second surgery where they extended the lateral release on the side to give it some more slack. It helped maybe a tiny bit, I can't tell. It stays full of fluid all the time, and that helps it move a little bit better, but it does not feel good. It is not fully functional. I can't ride a bike. I can't squat. When I go upstairs, it hurts and feels pretty awful. There's just a lot of tension because at 90 degrees, my kneecap gets stuck over here at the edge of my implant, and then when I go to use my quads to straighten it out, it has to bump back into the groove. And there's really no fix for that. I'm not saying this is going to happen to anybody else. It's always a possibility. I didn't know it was, but it is a possibility. Like I said before, one of my coworkers got the exact same surgery done, but he never had a history of fracture, and he went to a different hospital. He went to HSS, which I didn't really know about back then. I wish I did. He's had 0 problems. He has a little bit of grinding, still has some inflammation and stuff like that. He just recently went back to playing basketball a little bit, but he also doesn't approach rehab as aggressively as I do. So he probably could have done that stuff earlier if he wanted to. He's a little bit lazy about it, but that's okay. So now I am going to HSS. I had to wait over 1 year to even be able to talk to them. They took my case. First I went to someone who specializes in redoing partials. She went back and forth a little bit. She's like, I think I could redo it for you, but I have to send you to go talk to the total knee guy just in case, because we both have to be in the room. They had a couple meetings before I even saw him, so by the time I saw him, they were like, yeah, there's no point in trying to move it or replace it. The next step is just to do a total knee, and he gave me a lot more confidence in the outcomes these days, how long they last, what you're able to do with them, especially when you're doing it with someone like him. He's one of the top guys there. He's one of the top guys in the country. He helped design a lot of the technology that goes behind the replacements that I'm using these days. So I'm still very worried that I'm making a mistake. I know I need a total knee replacement eventually, but I'm hoping I don't regret getting it done so early. But the functionality is what bothers me the most. So this is more of I'm choosing to get this done to do the things that I want to do in life. I want to have a full athletic life. Doesn't mean I'll be able to compete at a pro level and anything, but I want to be able to ride a bike. I want to be able to go snowboarding without pain. I want to be able to do all these kinds of things. So I'm choosing to get the surgery done today. I'll try and keep making videos as much as I can, get back to my usual YouTube video routine, and keep you guys posted. If you have any questions about the knee stuff I got done last year, the partial replacement, the back, the shoulder, any more specific questions, keep adding those. Now that I'm off for work, rehabbing, I'll have a lot more time to answer all your questions and stuff like that. But thanks for following along, and I'll see you when I get home from the hospital.